Welcome to the Waisman Center exhibit booth. We're so glad that you have joined us today. We are going to give you some information about three of the projects that have come out of the Waisman Center. Now, the Waisman Center is a large interdisciplinary research center that includes an early childhood program, clinics, outreach, just so many things that we can't possibly describe them all today. So we're going to focus on just three. If you want to learn more, we will be available during the live exhibitor chats, and so we hope you'll drop by. I'm Tim Markle. I'm the director of the Southern Regional Center for Children and Youth with Special Healthcare Needs. As part of the exhibit today, we also have Carrie Arneson, who's our research registry coordinator, Beth Guthrie-Moss, who's the Wisconsin Youth Health Transition Coordinator, and we might also be joined by other outreach and information specialists if you drop by during the Meet the Exhibitors times. Today, we're going to share some information about our activities, highlight three of our projects, and help you to engage, learn, and find help that you might need. Let's start with the Children and Youth with Special Healthcare Needs program. We're funded by the state of Wisconsin through a federal program called Title V. And so we're part of a group that is called the Wisconsin Title V Children and Youth with Special Healthcare Needs program. We work together to improve the system of care and to help families connect to that system. Let's meet some of our partners. Our partners include the Wisconsin Medical Home Initiative. They work at empowering youth and families to become partners and leaders within their healthcare teams. We believe that the best health outcomes are when families and their medical providers can partner together so that the family needs are met and also the needs of the physicians are met. We believe that teamwork is going to result in the best health outcomes. We also partner with ABC for Health. They're a nonprofit public interest law firm dedicated to ensuring healthcare access for children and families. We will refer families that we believe may need some extra help with their healthcare access that we can't provide at the regional centers, but they also take referrals from the public. One of the other things we really like about APC for Health is that they help train us and they keep us up to date on the ever-changing world of healthcare access. We work with a couple of parent-based organizations. One of them is Parent to Parent of Wisconsin. They provide parent support to parents of children with special needs through a one-to-one connection with another parent who has similar experience and who knows firsthand about the feelings and realities that come with having a child with special needs. Parents are trained to become support parents through a training provided by Parent to Parent of Wisconsin. And then when a parent is looking for some support, that parent contacts Parent to Parent and they match them with a trained support parent who then reaches out and contacts the parent looking for support. We also partner with Family Voices of Wisconsin. This organization is excellent at guiding families through an overwhelmingly complicated healthcare system so they can find the services their child needs and the relief they need. They offer training such as What's After High School, Medicaid Made Easy, along with others. What I really like about Family Voices of Wisconsin is their ability to take the government speak and the legalese and put it into language that parents can understand. And so then they put out fact sheets so that I can understand what is the children's long-term support waiver, what is Medicaid, in easy to understand language for families. Well Badger Resource Center is Wisconsin's public health resource for children and youth with special health care needs and those with developmental disabilities and delays. There are a number of ways to get in contact with the Well Badger Resource Center. You can call them, you can text them, they have chat and email available, or if you happen to just be up late at night and you're looking for a specific answer to your question, they have an online searchable database that can help you find the information that you're looking for. We also work with Genetics in Wisconsin, which exists to give health professionals, patients, and families access to genetics information and resources. Of course, my favorite part of the children and youth with special health care needs system is the regional centers. As a director of the Southern Regional Center, I'm responsible for 14 counties in southern and southwest Wisconsin. But don't worry, we have excellent directors and excellent centers throughout Wisconsin. Matter of fact, we have 5 regional centers supporting families with children and youth with special health care needs and the providers who serve them. These centers are staffed by specialists who can help you get answers, find services, and connect you to community resources. Our services are free and private. We also provide training, such as Did You Know, Now You Know, training in medical home, and training in youth health transition. We want your family to be prepared for what's going on now and what's going to happen in the future. And so we invite you to call us at any time and ask us your question. We will do our best to find the answers for you and to connect you to your regional services. The other organization that is helping sponsor this exhibit is the Wisconsin Youth Health Transition Initiative. At age 18, children legally become adults unless other options aren't taken. And so we believe that healthcare transition, it's important to stay a step ahead. And so we recommend at around age 12 to start talking about transition, start talking about if you have a pediatrician, you may not be able to see them after you turn 18. You may have to go to a different hospital. Talking about how our healthcare changes from being led by a family member, a caregiver, to being led by the person themselves. And so we recommend having a little bit of time alone with the doctor so that the youth begins to understand that it's their healthcare and their doctor. At step 2, we ask you to be in the know. This could take place around ages 15 to 17. Of course, everything depends on the developmental stage of your child. But between 15 and 17, this is a great time to learn about how to make appointments, learn about how to fill medications, learn about how to talk about my healthcare needs, learn about what does it feel like when I feel good and what does it feel like when I'm really icky and I may need to call for help. And then step 3 is the actual transition to adult healthcare. Now, this can take place right at 18, but it may take place a little bit later depending on the specialty and depending on the healthcare system. It's important that as part of step 1, start talking about transition, that this discussion is also taking place with your child's doctor. Hopefully, they will be the ones bringing transition up to you. But if not, please feel free to talk about healthcare transition with your physician. You can get more information on youth health transition at our website. We also have a wonderful downloadable brochure, a pocket guide, and a healthcare checklist. We also provide trainings for providers, families, and community members. As part of our trainings, we usually talk about the transition readiness assessment. This is a great tool to see what skills and knowledge you and your youth already know, and what skills and knowledge they may need to work on so that they can take charge of their own healthcare to the extent possible. And finally, let's talk a little bit about the Waisman Center Research Registry. You see, the Waisman Center is an interdisciplinary research center. Our research projects focus on different areas, such as behavior, language, social development, learning, healthcare transition, and the role of family in human development. Many projects require participants who have a particular developmental disability, such as Down syndrome, Fragile X syndrome, or autism spectrum disorder. Other projects require participants who are typically developing. The Waisman Center maintains confidential registries of families and individuals who would like to be contacted about upcoming research projects. You can enroll in one of our registries to be notified when a study you qualify for is seeking participants. Joining a research registry does not obligate you or your family to participate in any study. Signing up only takes a few minutes. Learn more and enroll online at www.waisman.wisc.edu/registries. Thank you so much for spending a few minutes with us at our exhibit booth today. We hope you're enjoying the Circles of Life conference and that you're going to go home full of more knowledge, skills, information, and possibly even a few new friends. Please feel free to visit us at waisman.wis.edu for more information about any of the 3 programs that we talked about today, or any of the wonderful programs that the Waisman Center has to offer. Thank you. And again, we hope you are enjoying the Circles of Life conference, and we hope you have a great weekend.